Yes. We present our research regarding detection of circulating tumor DNA in patients affected by a colorectal cancer, but in a metastatic setting with peritoneal disease. Actually, in the literature, there is more and more result regarding patients affected by colon cancer, and we can evaluate ctDNA after surgery or before surgery, but the results are for primary cancer, not in a metastatic situation. And in a metastatic situation for peritoneal disease, part of the results are today negative. It seems to be difficult to detect circulating tumor DNA. Nobody knows exactly why. And we have used a very specific platform to detect circulating DNA and a very sensitive method using KRAS mutation detection. So we make a prospective study. We select patients affected by peritoneal colorectal metastasis with a colorectal cancer with KRAS mutation. And we collect the blood after the surgery of cytoreductive surgery, just before we perform the IPEC treatment at the operative room. And we have done that for 16 patients. And we collect the sample and try to find this KRAS mutation. And we only find one case, only one, with circulating detection DNA. It was very only one case. And in that case, the patient is affected by liver metastasis too. We don't know that before, but during cytoreductive surgery, we find a liver metastasis. And this is the only one that is positive. For all the other cases with peritoneal metastasis, they are all negative for ctDNA. So we confirm the first result obtained by other teams with a very specific and sensitive method. We have no circulating DNA in this patient. So it's quite strange for the result because usually everybody thinks that it must be elevated for metastatic disease. Our technique is able to detect circulating DNA for other disease. For liver metastasis, for colon cancer, we have positive results. For lung cancer, we have positive results, but not for peritoneal carcinomatosis. So we can imagine maybe that peritoneal carcinomatosis is probably different for other metastatic sites. We know that the chemosensitivity is less than liver metastasis. So chemotherapy had difficulty to go inside the peritoneal nodules. So it seems that ctDNA have difficulty to go in the bloodstream for this peritoneal nodule. And that could be very interesting for the future to try to understand that and to try if we can evaluate patients in a different time. By example, we plan to study the same situation, but not after the cytoreductive surgery, just before, to know if surgery can decrease this ctDNA very quickly or not. And majority of our patients have synchronous metastasis and receive first chemotherapy. So maybe chemotherapy can decrease this ctDNA result. So we want to study patients before they start chemotherapy for a peritoneal carcinomatosis.